Hello, I'm Dr. Patrick Hu, CEO of Moffitt Cancer Center. We're coming to you from ASCO 2023 in Chicago, Illinois. Really happy to have Dr. Luis Aguirre here, one of our star fellows at Moffitt Cancer Center. So thanks for being here today.
Thank you so much for having me, Dr. Wu.
Congratulations on your Conquer Cancer Merit Award here.
Thank you so much.
Wonderful. Now you're studying CMML.
Right.
Yeah, tell us what is CMML?
So a lot of people tend to confuse like CMML with CML. I mean, outside of the realm of hematology, but CMML actually stands for chronic myelomonocytic leukemia, and it's a very rare type of blood cancer. So, like I think the annual incidence of this cancer is 1 in 40 million here in the United States at least, but it's associated with horrible outcomes. I think the median overall survival is like 3 years. And what is interesting about this condition is that it's an overlap syndrome, meaning that it has features of both, like myelodysplasia and myeloproliferative neoplasms. But as you know, like Moffitt is one of the top cancer centers in the whole world that deals with this specific type of patient population.
Yeah, I like to say there actually are no rare cancers at Moffitt Cancer Center.
That's
we
true.
have so many patients
That's true.
with all the different kinds of cancers. So tell us about your work with CMML. What's the best treatment for it, and what are you doing with CMML?
That's an excellent question, because like CMML has, as I said, like overlapping features of both MDS and MPN. Basically, the way that we treat this condition is contingent on the pattern of presentation. I mean, if it behaves like a myeloproliferative neoplasm, then we treat, like constitutional symptoms and we address those issues. But if it presents with features most likely related to dysplasia, then we treat it as MDS. The interesting thing on the data that I'm presenting here at ASCO is mostly related to validation of a new risk stratification model called IPSSM or IPSS molecular, which was introduced mostly for patients with myelodysplastic syndromes just recently, and it expands on the traditional mutation agnostic models by including data on somatic oncogenic mutations across 31 different genes. So what I wanted to do is, because we know that CML and MDS tend to be like misdiagnosed, like confused in the community, I wanted to see if the applicability of this novel risk stratification model for MDS could also like extend for patients with CMML. And the interesting thing is, based on the validation of those findings, is that yes, I mean, in community settings, we can use this risk stratification model without actually compromising any significant accuracy in terms of treatment decision making. But as I said, I mean, it's very unlikely that in academic settings we're going to confuse both. My whole idea behind this project was to try to see, because the IPSSM is this novel tool, if it could be used in community settings without the risk of making any unusual decisions in terms of treatment. And yes, thankfully, it can be used in those settings as well.
Great. And so what's in the future for treatment of CMML?
So I think that there are a lot of interesting elements down the road. Particularly, I think we are investigating the use of a novel type of drug called BET inhibitors in combinations, mostly for patients who are presenting with myeloproliferative features. In terms of MDS, unfortunately, in terms of specific medications, there's nothing down the road, because as you know, like treatment is basically tailored, I would say, on a patient's presentation based on clinical and molecular features, and particularly, mostly, I mean, based on risk stratification patterns and as I said, like what kind of phenotype the patient has, if it's either dysplastic or if it's most proliferative. But as I said, I mean, there are like a lot of interesting medications down the road that are currently being investigated in CMML. And Dr. Padron, like with us, like our star in CMML, is currently involved in many clinical trials trying to see what kind of treatment options do we have like down the road.
What about T-cell therapy for CMML?
That's a good question. I don't think there's anything down the road, at least from my perspective. But yeah, I mean, that's what I know from that perspective.
Great. Well, thanks so much for being here with us today. Congratulations
Thank you so
again
much.
on your award.
Thank
Dr.
you so much for
Luis
having me.
Aguirre, Star Fellow at Moffitt Cancer Center.